I always say, even before, you know, there's a lot of us, you know, as soon as I reach 40, been there, done that. As soon as I reach 50, been there, done that. So many of you are saying, you know what, I'm going to get those injections or what have you. You know what, that's great. You know what, but I always say try. As you can see here, if you have issues with your skin, you want that lifting, you want that suppleness, you want that to help in the toning and such, and that evenness that this can help you with. Remember, it's retinol, and it is the Tetrol E that we have for
Tetrol E,
Tetrol E inside here. It's a stabilized retinol. It's not the retinol that was around 30, 40 years ago. Even though retinol is, I'll tell you, unbelievable. But science changes, so should retinol, and that's what they found here. You were saying 17 patents on that? 17
patents alone
that
with the stabilization process. Well, it's just testament to how much research and development Neutrogena Dermatologics does. This is a company that is well known, well established in the medical literature. Professional level solutions, high-end technology for people who want to jumpstart their anti-aging regime.
And this is the last show, less than $1 a day on that first payment, everybody. And then, of course, you have our 30-day money-back guarantee. Dr. Will Kirby and I will be back. We're going to take a little bit of a break. We have a great Today Showstopper that we have for you coming up with Chad Telfer in the midnight hour. But Will's going to be joining me. And if you have any questions, give us a call.
Inspired by the renowned Shopping Boulevard.
What's going to be coming up next is the Neutrogena Dermatologics. It is the Retinol NX Wrinkle Filler. And I have to say what Dr. Will said in the last show, it's the Wrinkle Fighter. I approve of that one even better. This is result-driven, everybody. This is when you think of filler right away, it's going to be temporary. It's temporary in the beginning because you're going to really target those areas. But the more you use it, the better the results. And as you can see, it's at an introductory price of $65. And they do work hand in hand, don't they?
Very much so. The first product we talked earlier, and I don't know if I really emphasized this enough, that's a full facial product. You can use it actively or prophylactically to treat the signs of aging, those fine lines and wrinkles that you're developing over time. This is a targeted product. You really want to focus with this, like you said, and fight those areas that have those deeper creases, those deeper wrinkles that are really starting to accentuate that aging process.
And maybe yours are the number 11s. Dr. Kirby has the real terminology for it.
We call it the glabella complex.
Okay, that's where
those are
complex, not knowing it.
In between the brow.
But maybe yours is it's the crow's feet. Maybe it's the marionette lines. Maybe it's the laugh lines. Wherever you want to target. That's what I love. If you want to use it on all those spots, it's up to you. But all of us have our quote-unquote issues. If you want to target on top of using your serum, everybody, highly recommend this because it has that superpower inside.
It really does. I'm so passionate about this product because the ingredients are incredibly exciting. It has the same stabilized retinol technology that we talked about earlier. The entire line does, and we talked about the 17 patents, the 2,800 medical publications, blah, blah, blah. It's well established. But this also has something else that's absolutely remarkable. It has hyaluronic acid. Hyaluronic acid is a naturally occurring substance in your body. It's clear, it's gelatinous, it's like a very thick jelly. And if you've ever heard of people getting lip augmentation or getting their lines filled on their face with injections, they're almost exclusively using hyaluronic acid. I do it in my office in Beverly Hills. The difference here, Neutrogena Dermatologics has taken that same hyaluronic acid, put it in a product that you can apply to the surface of your skin to diminish the look of those fine lines and even those deeper creases and deeper wrinkles.
Now, when you think, and it's something our body already has in the past, because, you know, congratulations, you have a little 15-week-old.
That's correct.
100% full of all that beautiful hyaluronic acid. But as we get older, just like you know, air coming out of a balloon, just kind of disappears. Well, this product helps to put it back.
Well, I'm going to steal your analogy. Since you stole mine, I'm going to steal yours. When you talk about comparing a grape to a raisin.
Hey, if Beverly Hills doctor wants it, you can
Thank you. That's a great analogy. You see that grape, it's plump, it's soft, it's succulent, and then as it loses that moisture, or in this case, that hyaluronic acid, it really dries up.
They make wine from grapes, not raisins.
There you go. There you go. The analogy I make here, too, is that keep in mind, hyaluronic acid can hold up to 1,000 times its weight in water. Whoa. So you can think of it as sort of a microsponge technology. It's it's hydrophilic. It loves that water. So what I have here is just a dry sponge. It's a really hard, dry sponge. You can imagine this is hyaluronic acid. Imagine applying it to the surface of your skin already contains that moisture, but we really want to plump it up. So when you put them together, just over the course of just a few short minutes, you notice it really starts to plump up, it starts to absorb that water. That's exactly what the hyaluronic acid holds up to 1,000 times its own weight in water. That's exactly what that hyaluronic acid does on the surface of your skin.
That's amazing.
To plump up and diminish the look of those fine lines, wrinkles, even deeper creases on your face.
Okay, now, how do we use this?
So incredibly simple. We talked earlier, the serum, thin layer to the entire face. The hyaluronic acid, just a tiny little bit, a droplet amount. You can see a little droplet on my hand there. That's enough to cover even the deepest wrinkles. Maybe those for you are the nasal labial lines from the lip to the nose, or maybe it's the marionette lines from the bottom of the lip to the chin. Dab, dab, dab. It has a very almost a spongy feel. Excellent level of humectancy with this product. It's really, really smooth, absorbs very, very nicely, and you see a result very quickly, and those results continue over the course of time. And you know me, I back up with the things that I say. I back them up, and we're going to give you a clinical study in just a minute to show you some of the statistics that people noted in a clinical test.
Now, not saying that you can't use it twice a day, the serum that we just showed, and we're going to get back to that. How often do you recommend using this?
This is a once-a-day product, just like the serum.
Okay.
The serum, I personally use it every single night. The wrinkle filler, the wrinkle fighter, I use a tiny little bit. I don't need very much, just to be candid. I don't have a lot of deep wrinkles, but I use a tiny little bit every single day. Then I apply my broad-spectrum sunscreen.
So it's simple and easy. What are your issues, if you have any? Maybe it is the number 11s, or is it the forehead? Is it maybe the crow's feet? Whatever that happens to be. This, to me, I love because it's really targeting. I mean, it'll last a lot longer if your issues are maybe a little bit milder and you're thinking, you know what, or maybe, you know, when you're starting, I'm saying 35, 40, 45 and such. But even if you want it as preventative, you could certainly be using this, and a little will certainly go a long way. But this is what I love, because it's designed for your specific needs. We have two products in the show, everybody, and I think in this day and age, you know what, we don't want to be confused. You know, even 24 hours in one day is not enough time for, especially, you know, busy moms and dads out there. But when it comes to skincare, it really is keep it simple, but I want results.
Keeping it simple is so imperative, because when things get complicated, people remember it the first day, they'll remember the second day, the third day, they say, oh, this is too complicated, I'm too busy, I'm too confused, forget it, I'm not going to do any of it.
Which order do I do this in, you know?
Exactly, and if you can't stick to a simple regime, you're not going to get results.
Absolutely.
So Neutrogena Dermatologics puts highly efficacious products into their formulation so that it's very simple. So you're getting great results, and it's really simple to stick with.
Take a look at this before and after.
This before and after, I'll tell you, I like it, I don't love it. And the reason is these pictures don't do this justice. This woman had such a phenomenal result in person. If you get up close to your TV, take a look in between the brow, that glabella area that we talked about, or take a look at the frontalis muscle, which causes the forehead wrinkles. She had a really, really softening of those lines and creases after just 8 weeks. And the effects are cumulative over time. And once again, in just one application, 72% of users showed improvement in the appearance of crow's feet and fine lines. You get exceptional hydration with this product, lasting up to 24 hours. And once again, it's called wrinkle filler. I call it wrinkle fighter. As you said earlier,
I love that term.
Wrinkle filler implies that it just fills so that it's almost like spackle. That is far from the case. This is a treatment.
And we do that sometimes in makeup as almost like a primer, and that's temporary. This isn't. This is a fighter. This is going to work with you. I mean, look at the results after 4 weeks.
90% of users showed improvement in those deeper lines and creases and wrinkles. So it's just a phenomenal product. Any way you slice it, the hyaluronic acid is a remarkable technology, absorbs up to 1,000 times its weight in water, and we're losing it every single day as we age. So if there's any way that you can apply it to the surface of your skin to diminish those fine lines, diminish those wrinkles, people just are really, really pleased with it.
If you're just joining us, my name is Richard. Nice to have you, everybody. And of course, Dr. Will Kirby is a board certified dermatologist from Beverly Hills, and many, many different accolades. And he also teaches at 2 universities, 2 medical students. And you know what? And I don't think you would put your reputation and your name and your knowledge of all the different products and such out there if you didn't really respect it.
That's exactly the case. My professional reputation is on the line here, and I say I'll tell you, the only thing more important than that is how I actually treat myself, because I'm a very vain person. I have no problem saying that. The same products I recommend to you are the same products I use myself. So not only do I recommend this line, and I love it from a professional standpoint, but I love it from a personal standpoint. It's a line that I use, and my family uses it.
And you know what? And it's the simplicity of the line. Like I said, Neutrogena has been around for 40 years in over 70 different countries, and maybe you've come to love some of their products, especially their sun products and, of course, their skincare products. But dermatologics, and that's what the serum, and that's what you're seeing here with the wrinkle filler, which we're calling the wrinkle fighter, is a separate division. This one here is more, I would say, more top drawer, more cutting edge, more R&D behind it, with 17 different patents, everybody. To me, and when you use the product, it's got to work.
Of course.
I need for it to work with all of that, money, time, and effort that's put into it.
Well, that's the bottom line. I mean, you can, I always tell people you can spend a tremendous amount of money on a good product, or you can spend a reasonable amount of money on an absolutely phenomenal product. And a lot of times when you purchase a product, if you get something at a department store, you're paying for that experience. And there's nothing wrong with that, but you're paying for that packaging, you're paying for the fragrance, you're paying for the beautiful clothes the person behind the counter is wearing, and you're paying for the rent. And at the end of the day, you really have to use products that have proven studies and clinical scientific publications standing behind them.
Now, what about sensitivity? If there's somebody out there shopping with us right now, and that could be in many different forms. Maybe yours is rosacea, maybe it's some sort of a irritation. Again, you always listen to your skin, but is this safe to use?
This is indicated for all skin types. Even people with the most sensitive of skin in our study tolerated it very, very well. We had a caller earlier tonight. She spoke to one of our producers. She said, "I have rosacea. Can I use the product?"
Right.
And the answer to that is absolutely yes. The more fair-skinned you are, the lighter your skin tone is, the more likely you are to have the signs of rosacea. Right. Rosacea is a medical condition. This does not treat rosacea per se. I should preface any discussion by saying that, but by the same token, individuals with rosacea tolerate this product very, very well.
And you know what? Try it, everybody. We have 8 minutes remaining. This is the final show. I know Dr. Kirby has had a few visits here with us. If you've never tried it, take advantage of it. If you're brand new to us tonight, just watching for the first time, nice to finally have you here. Take advantage of one of those interest-free easy pays that you see on your screen, plus your shipping and handling and your taxes. We'll send it to you. Use it. You're recommending once a day?
Once a day.
For those 30 days. Try it, for goodness sake.
Exactly. I use it during the day. That's just the time I find it most convenient. Let's say you already have a daytime regime you absolutely love, and you're looking for something that really, or let's say your needs aren't met, and you're looking for that product that you really want to kickstart your anti-aging regime because you have deeper lines, deeper wrinkles. That's where this product comes in. It's very simple to use. Just use a droplet amount. Put it directly on top of any deeper lines, creases that you may have.
And the way that this is, made for you, everybody, this is a 60-day supply. I don't want you to be overusing this because, I mean, remember, you're targeting, and whatever your issues happen to be, absolutely use it with your serum, and maybe you want to use it with something else that you're using. If you've, it seems like maybe sometimes you feel like you've plateaued. Maybe you think that, with your skincare, maybe there's some events that are going to be coming up, and you think, how can I take it to another level without getting the alternatives? And there's nothing wrong with that. It's nice to have all of those between injections and everything else. They scare me. I find those expensive, and you know what? They're temporary. But when we can help you on a long-term basis with ingredients that have 17 different patents and so much research and development, that's what dermatologics is. It's a separate division to give you answers to solutions, to problems that you have, and these are the solutions.
I think everything you just said is just so right on.
Thank you, sir.
And it's great working with someone who's so informed about this process, because I really think the thing is miscommunication that's out there and misinformation. And when people get on a regime that they can stick to and that they're compliant with because they understand it, then they get a great result. What else goes hand in hand with that? Efficacious products.
Always.
And this is a company that produces those.
And because I was telling Dr. Will, he was asking me how long I've been here, and I've been here for 15 years. I get to try everything, and I don't try everything. I have my favorites, and I have not tried this. I don't want you to think, oh, Richard, he's loving every product. No, I've never tried this. I can't wait to try it because I have my favorites. You have your favorites. Who says I can't incorporate this into my regimen? Now being 51, things change. They changed at 50, they changed at 45, they changed at 40. But when you have science and technology backing you up, this is incredible. Try it. If I'm going to try it, I want you to try it. And next time Dr. Will is here, we'd love to hear from you. We have a lot of shy people. I've been asking for people to call in if you have any questions. Like I said, he's the only dermatologist probably in North America right now that will take your call live on TV. So especially at this time of the evening. So do some shopping with us, and if you have any concerns or any questions, please ask, because it's really simple and easy to use.
Let's talk about you know, I love to talk about skin. Like you said, I love to hear myself talk, but I love to educate. How does the adult skin cycle work? Every single day, cells are being born, cells are sloughing off. 35 to 57 days is the normal adult skin cycle for cellular. It's a long time, and I mean, 35 is one thing, but as you age, it slows down, slower,
Like everything else, Doc.
And like everything else, and when you're getting up that 57-day marker even farther, that's why your skin loses that luster. That's why it gets sort of that dull, sallow color, that dull hue. And what do we want to do here? We want to increase softness. We want to increase smoothness. We want to restore luminosity, and that's exactly what this product does. It does a phenomenal job of really giving you a beautiful, more youthful appearance to your skin.
Now, we have less